Hey guys, today I want to talk to you about something concerning uh, about what's going on with Medicare. Now, I know a lot of news reports have discussed the different changes that are happening with Medicaid and the Affordable Care Act and things like that. But it really feels like a lot of these Medicare updates have slipped below the radar and just not been noticed by very many people, which is really bad news, honestly, because Medicare is a lifeline for millions of low income seniors and people with disabilities. It is a huge deal when this program gets messed with. So, today we're going to talk about some of these little budget maneuvers that have been made, which are going to affect your access and the accessibility of this program, and other things that you need to be aware of if you rely on Medicare benefits. Now, of course, we always recommend that you reach out to our sponsored chapter if you need help making sure that you're on the very best Medicare plan for you. Now, I know a lot of Medicare agents push Medicare Advantage plans even when they're not right for you and they don't make any sense because a lot of times they make money doing it. That's why I prefer to partner with Chapter because they don't just tout the amazing benefits of Medicare Advantage. They will walk you through all of your options, even original Medicare or supplement programs or Part D or Medicare Advantage, whatever, and help you understand the pros and cons of every option that's available to you. They're going to help you compare every plan, taking into consideration your specific health needs, because they want to make sure that you have the best coverage for you. That's why they're a 5-star rated service. And there are so many reviews from people that are just absolutely thrilled with the support and the help that they've been able to receive. I know we've had great conversations with a lot of you in our comment section who reached out to Chapter and got just amazing results from those phone calls. It only takes about 20 minutes, and they say that on average, they're helping people save over $1,000 a year just by getting them on the right plan. So if you are on Medicare or you're going to be soon, please reach out to them to make sure that you're getting the best support. And that's more important than ever right now, considering what's going on behind the scenes. And we're going to be talking about that throughout the rest of this video. So, as you know, we've seen big omnibus bills go through with, the One Big Beautiful Bill Act, and we've seen them using budget reconciliation rules and different things like that. Now, we know that politicians are using budget reconciliation rules and different things to force through different changes. And we've talked a lot about how that's going to impact Medicaid or the Affordable Care Act, different things like that. But I recently saw a report that said that because of those changes, there are mandatory rules that will force cuts of almost $500 billion from Medicare over the next 10 years. And that is a lot of money from a very sensitive and important program. So basically, this is why it's coming to a head right now, right? Because we're coming up against that deadline for that government shutdown, and a lot of the dispute is happening over healthcare. From what I've read in multiple news sources, it sounds like congressional Democrats are refusing to help keep the government funded unless their opposition meets certain demands, right? They want to restore what was cut from Medicaid and the Affordable Care Act. And they want to guarantee that the administration won't use impoundments to withhold funds that are approved by Congress. That's what I read in a couple of different sources. Now, part of the reason they're doing that is, well, obviously, a lot of people are going to be affected by those cuts, and it's going to have some pretty serious consequences. But even people who aren't on Medicaid or don't use the Affordable Care Act may face higher premium costs because of the way that the market works. So they're trying to get some of those changes undone. Now, the prospect confirmed that the One Big Beautiful Bill Act triggered these almost $500 billion in cuts to Medicare over the next 10 years, and those are supposed to begin this October. This is because the PAYGO Act of 2010 requires automatic cuts whenever legislation increases the deficit. So, this was explained apparently in a letter from the Congressional Budget Office dated May of 2025, which basically said that Medicare spending would have to be cut by about 4% per year. Now, 4% doesn't sound like a lot, but for a program as big as Medicare, that adds up very, very quickly. So, in addition to those cuts, this is in addition to those cuts, the Department of Health and Human Services is also rolling out a program that will use AI tools to require pre-approval of procedures. This pilot program will launch in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. And this is going to affect your traditional Medicare benefits, which have typically not required pre-approval in the past. So that is another way that benefits are going to start being curtailed in certain areas. The prospect reported that they received a copy of a letter that 17 senators sent to Dr. Oz and Abe Sutton at HHS, demanding more information on this pilot program because they claim that the rules were not followed in the implementation of that pilot program. So I know this is very specific and policy driven and maybe even a little bit boring, but I think this is really important. This article in the prospect says, quote, the letter shared exclusively with the prospect noted that CMS deceptively classified the pilot program as voluntary, allowing it to bypass the usual notice and comment process required in rulemaking. In truth, the letter pointed out, the pre-approval process will be mandatory for clinicians in the 6 pilot states, or they risk not getting paid. End quote. So it's voluntary in as much as they don't need to be paid for their work, I guess. Um, but basically, they're saying in this quote that they use the word voluntary to get around the comment and notice procedures that are supposed to be in place. But in reality, it's not really voluntary, right? They have to do it or they're not getting paid. And that makes it not a voluntary program. So we'll see how that moves forward if they're able to do anything about that pilot program. But in the meantime, like I said, the Congressional Budget Office is estimating that Medicare is going to face about $500 billion in automatic cuts over the next 10 years. And this pre-approval may just be one way that they're choosing to implement that, because we know that denials and delays in coverage are going to be likely to increase. That's what prior authorization often does, which risks worse health outcomes, delays in diagnoses, treatment, preventative care. And the reason you need to know about this is because studies have shown that low income patients are disproportionately affected by things like this because they're more likely to have their claims denied and they are less likely to appeal. And I need you to hear that very, very clearly. Because if you are on Medicare and you're relying on those benefits and you get subject to these pre authorization requirements, you need to remember that you can appeal and you should appeal. Gather your medical records, ask for their denial reasons in writing, do some research, follow the formal appeals process, reach out for help if you need to. Organizations like Medicare Rights Center, Legal Aid, or advocacy nonprofits may be able to help you navigate that, but you need to make sure that you fight for the benefits that you're entitled to. You can also contact your federal representatives, ask them to oppose automatic Medicare cuts, ask them to do something about it. Demand transparency and ask them to protect low income beneficiaries because they are especially at risk from changes like this. I know this wasn't great news today, and I am so sorry. Please remember that our sponsor chapter is always on your side. They can help you make sure that you're getting the absolute best out of those benefits. And we will be back soon, hopefully with better news and more ways that can help you save money and get free stuff because that's what we love to do here at this channel. I don't like bringing you guys bad news, but I appreciate you and we'll see you again soon.